As coronavirus cases surge even further, local hospitals are now having to decide whether to suspend or postpone elective surgeries. Pushing back non-emergency operations can free up staff and keep attention on those who need care immediately. Thanks for being with us tonight. I'm Nikki Lorenzo.
And I'm Eric Rucker in this evening for Eric Harriman. The other side of all this is that those delays could lead to long-term health consequences. Fox 40's Zach Boetto explains.
Doctors say knee replacements and other cosmetic procedures, those things that can be scheduled ahead of time, can wait until hospital space can be improved. But other serious infections and urgent medical conditions, those things that might worsen quickly, might have to be treated right away. Hospital teams are looking at patients on a case-by-case basis to decide the priorities, saying some people should be ready if their elective surgery gets postponed.
One thing that is part of every hospital surge plan is at some point canceling elective surgeries.
Staffing challenges brought upon by the fast-spreading Omicron variant are forcing health officials across the region to decide each day which scheduled surgery should continue and which should be canceled. People who are experiencing serious medical problems, including severe COVID symptoms, should still call 911 or go to the hospital on their own. But health professionals are left to make the call about procedures for less serious illnesses or conditions.
Like most other hospitals, if not all other hospitals in this region, Mercy General is looking at all of our cases, and we have postponed some of our elective cases that can wait.
Kaiser Permanente says it's making adjustments to maintain care, including employing traveling nurses, adjusting elective and non-urgent surgeries and procedures as needed, and offering the telehealth capabilities. UC Davis health officials say they're not canceling surgeries, but postponing a very small number to ensure they have that sufficient staffing. Some county health officials say while waiting might be necessary, it could have serious effects later on.
One of the things that we've seen during COVID is that people have delayed necessary care, and that leads to bad outcomes down the road.
Dr. Sisson says right now Yolo County hospitals do have availability, but expects to see more patients in beds in the coming days.
While they may be okay today, a week or two from now, it may be a very different situation with the hospitals not having beds available.
Doctors want to make it clear people suffering from chest and abdominal pain or having stroke symptoms or other very serious concerns, don't delay, come in right away to the hospitals. From Sacramento, Zach Boetto, Fox 40.